The Productivity Commission has called for a drastic overhaul to the way mental illness is managed. It's costing the country $500 million a day. The Commission's draft report finds that 4 million Australians are dealing with mental health issues and 1 in 7 children is affected. The Commission recommends screening young children for anxiety before they start preschool, along with improved support in schools and workplaces. Here's political reporter Amy Greenbank at Parliament House in Canberra.
It's found that sweeping changes need to be made to the mental health system, the major finding being that mental illness is costing the economy $180 billion every year. Breaking that down, as you mentioned, that is $500 million a day. Let's take a look at some of the more startling figures that have been contained in this report, which has been delivered by the Productivity Commission, finding that mental illness will affect 50% of us over our lifetimes. It's responsible for 1 in 8 visits to the doctor, and 75% of those affected will have their symptoms come early in life, before the age of 25. Hospital emergency visits for mental illness over the last 15 years have jumped 70%, and 1 million Australians are currently suffering a mental illness, Joe, but not getting treatment. Let's take a listen to the Commission's Chair, Michael Brennan, as he explains how they calculated this $180 billion figure.
We spend $18 billion directly on mental health, but the true cost is 10 times that once you take into account the lost productivity and participation and the loss of life and the years spent in ill health.
So, Amy, this is a draft report. What are the recommendations?
Well, they're calling for drastic changes, but in this draft report there is a real emphasis on early intervention, particularly screening toddlers for mental health conditions like anxiety and depression when they go to get their regular health checkups at the doctor, and making sure that is available before they enter preschool. Now, another recommendation would be to employ wellbeing teachers to make sure that kids that are struggling in school have access to a psychologist if they need it. This is mirrored off a program that is currently running in the United Kingdom that's recently been introduced and is showing positive results, but Joe, it would come with a pretty hefty price tag. It would be estimated to cost around $1 billion a year.
And you've already mentioned some of the numbers, but take us through them in a bit more detail.
Yeah, it's quite alarming. 4 million Australians are currently living with a mental illness. That's about 15% of the population. And of those, 1 million people are untreated for their condition, and that can range to quite severe conditions like psychosis or borderline personality disorders. So the Productivity Commission making these startling findings about the prevalence of mental illness in the community, but also saying it's being treated as like an add-on to the regular health system, and that is a real problem. It says some of the reasons people aren't going to get treatment is because there is a lingering stigma in society about mental illness, but also people simply falling through the cracks because it's too hard. The president of the Australian Medical Association, Dr. Tony Bartoni, says this is something he's been warning about for a long time.
Clearly, it does highlight the lack of a complete overarching mental health architecture. It's comments that we've made time and time again, and government needs to understand that it can't shirk that responsibility any longer. The community need a robust mental health system.
And the Productivity Commission, Joe, will make its final report to government next year.
And if you need information or support, you can contact Beyond Blue on 1300 22 46 36 or Lifeline on 13 11 14.